How are you, Mr. Rafakat? Hope you are doing great here.
I'm okay, I'm very fine.
Okay. Could you tell me a little bit about your background, about your education, your family, where do you come from?
I come from Dewsbury, West Yorkshire, a place called Dewsbury. It's in West Yorkshire in the UK. I come from there. I'm a economy family, not rich, not poor, but just medium. And I was on drugs, which is called cocaine and crack and cannabis. I started that when I was in the UK quite heavily. And I've come into some of my sister-in-law told me about this rehab, told me to come here.
Okay. Can you tell me a little bit about the situation or the problem that you were facing before the start of the addiction and that made you propel towards the addiction?
The addiction made me to hear voices or hearing voices, and I was thinking that people are after me, which though it wasn't. I was thinking that there were people trying to kill me and trying to, do this things to me because I was on cocaine, crack, cannabis, and I went heavily on it. And my sister-in-law told me about this new home, to go there, and you'll get a very help, which I did, made a attempt to. I said I'm gonna go.
Okay. If you go back in the past, can you tell us, what was the situation? Was you hanging out with the friends, going for partying that made you addicted to these recreational drugs?
I was going out partying out with my friends before I did not used to take them. But then I started going out partying, then house parties.
Okay.
Other people were taking drugs, and I started to take drugs, cocaine to crack, and some crack heroin as well.
Have you ever had an idea that these drugs are very much detrimental to your mental, physical health, and they can cause even death?
I didn't know at that time. No, I didn't know.
Thank God that now you know about this.
Now I know what the dangers was and what we're going through now because of
Okay, can you briefly elaborate how badly it impacted your social, financial, and family life?
It did because it made me away from my family so much because I was taking drugs. My wife, I got 4 kids, got 4 children, girls, and I got a wife. She made me far away from them. And I was getting problem on my feet then really bad because of taking drugs. I didn't realize how it's really happening to me. I really got into drug problems. I got into debt. I owed people money. And I couldn't pay them up, and there were people coming to ask for my family.
Oh, okay. Coming to the treatment phase, can you elaborate what problems you faced during your detox period in the rehab center?
First, when I come here, I was hearing voices again. I said, this is not happening to me, but there's still people after me. It took me basically just 1 week. They said, we can't say we'll give you detox, we'll give you tablets, we'll give you the medicine, they talk to you. They talked to me, they gave me tablets. When I had them tablets, in 1-2 weeks, I had them voices slowly, surely, they went away. And they got a lot of help from the staff.
Okay. Are you satisfied with the level of nursing care, treatment with the psychologists, counselors, the doctors?
Oh yeah, 100%, I can say that. I can say because today I'm fine, I'm not eating voices, I'm ready to go home. And I'm not eating all because of these therapies, this help from the doctor, like yourself, and the staff members giving me the time.
Okay, you must be knowing that many of the patients of drug addictions, before going to the treatment, they're so much scared about getting treatment because they think they might not handle the cravings, the withdrawal symptoms, and they can even die from it. Did you have any of the fears before treatment?
Oh yes, I had the fears as well. They don't want to treat me good. That's why I said that, that I was thinking the rehab setting me up in my mind. I was thinking that, it wasn't true, it was all in my mind. I was very poorly at that time, very, very poorly. since from that time, it's not even been like full 3 months. I mean, I recovered fully. I mean, this rehab, the stuff, and the tablets, and the tablets, what they gave me, the medication, the therapies, the medicines, and myself, and the stuff.
I'm glad you are so much satisfied with the care that you
Oh, very
provided here.
100%, I'm happy.
Okay, how was your psychotherapy sessions, your meeting with a drug addiction counselor, your group sessions, your spiritual therapy? How did they impact your thinking, your mindset?
Before he didn't, but when I started taking therapy sessions, when I told how you're feeling, how you going, who are you gonna, she's doing relapse again. You think you're ready to go home, and with them sessions, I can tell them how I feel, and how I am, how I was, and how I am now. What my plans are to go out and I go back to UK. I'm ready.
Okay, how mentally prepared are you that when you go back in UK, you don't start abusing the similar drugs, not sitting in the company of the friends who drag you into the addiction?
I'm not going to do that anymore because I've learned my lesson out. The drugs brought me to that stage where I could have got killed or anything could have happened to me. If I didn't come in this rehab, didn't get the help, anything could have happened to me. I come to this rehab, got help, and I'm not going to go back to running drugs.
So, what message you would give to people living in UK who are searching for treatment options?
I'm going to tell people, my mates who I used to hang around, I'm going to tell them this is the treatment why I'm open now. Totally, I don't get no craving.
Have you ever been treated in UK?
Never.
So this was your first treatment
This was
here?
my first treatment here.
Alhamdulillah, you have been so much cooperative during your treatment, and we wish you best of luck for your lifelong recovery.
Yes.
And we are always here to help you.
Yes.
And we hope that you follow the follow-up sessions program and you stay in contact with our management team, with the psychologists, with the doctors, because drug addiction is a very evil disease.
Oh, yes.
Because you have to be vigilant throughout your life.
Yes.
Because the relapses can happen anytime. So you have to be vigilant, you have to be observatory, and you must be well equipped to guard your sobriety, your recovery, because you have gotten this thing after going through a lot worse phases.
Yes.
And I hope that you protect your recovery and stay in contact. So thank you so much for listening to this podcast, and inshallah we will bring you more such interviews. The purpose is not the advertisement, it's just to encourage the people who are in a thinking process to get the treatment for their drug addiction, so that they get the professional help. If it is not affordable or not feasible to get it in UK, you can come to Pakistan, search for the better options here, the option which suits your needs, the options which are well equipped with the latest medical knowledge, with good nursing care, with a cooperative, respectful staff. And many of the such patients have been recovered and they went back to UK and then spending their life in a much better fashion. So we expect that you will also have a great treatment here in Pakistan, and we wish you best of luck.
Thank you.